The idea is that we work as a community rather than making strict, okay, now it's age 65, now it's age 55, as we had to do before. We want to just take this on as a community and say, everybody who's eligible, you'll get your third dose. We want you to, but can you please let them in UMCO go first? If you have relatives who have cancer, please take them.
The program allows for self-attestation of underlying health conditions, and the CDC has identified a list of high risks, including pregnancy and even smoking. The boosters are only for 2-dose Pfizer patients. Clinics are to be set up at the usual places at the mall and UOG.
We know that the 2 doses drastically reduce the number of people who got sick, but there are so-called breakthrough infections. They're generally very mild, but we want to increase the likelihood of them remaining mild, and for those who are particularly vulnerable, to maximize the impact of the vaccine effectiveness by giving that 3rd dose.
But the 3rd dose vaccines were only recently approved by the CDC and are also still under emergency use authorization. While some might be put off by that, Berg believes most won't.
We think that almost everybody who is eligible will come out, because we're asking that we do this as a community. The EUA component of it, everything that we're doing with COVID, we're having to react quickly, and that's not a bad thing. The EUA, emergency use authorization, that is because we're dealing with an emergency. And on Guam, maybe we have even a higher risk of having things go badly because we have limited healthcare resources.
The multi-week surge shows little signs of slowing, but Berg says it may be reaching a plateau.
No, I would say we're not doing as well as we'd like, but we're getting there. I think the fight on the part of the community is actually working to at least stabilize things.
Berg says there's no plans for additional mandates at this time, but there's been a greater focus on data collection and analysis, including, for example, biweekly testing of teachers and students at schools.